Diabetes isn't just about blood sugar. It can also leave signs on your skin. In many cases, these skin changes serve as early warning signs, hinting at undiagnosed diabetes or signaling that your current management may need adjustment. Today, we'll explore 15 skin symptoms that could indicate diabetes. If you or someone you know notices these changes, it's important to consult with your doctor. Often one of the first signs, diabetic dermopathy, appears as round or oval, brownish or reddish spots on the shins. Initially scaly and later becoming flat with small indentations, these spots may fade if blood sugar is controlled, but sometimes they can persist. Their presence, particularly in someone who hasn't been diagnosed, is a reason to get tested. A thickened, dark patch of skin that feels velvety, commonly found on the neck, armpits, or groin, is known as acanthosis nigricans. This sign is especially associated with prediabetes and insulin resistance, highlighting a need for a full metabolic workup. Some individuals with diabetes develop skin that becomes hard, thick, and swollen, most typically on the upper back. This gradual tightening over months or years, called scleroderma diabeticorum, does not affect the hands or feet, but indicates long-term changes that may be linked to diabetes. Long-term high blood sugar can damage nerves and impair circulation. This damage leads to slow healing, particularly on the feet, and creates a fertile ground for developing open wounds or ulcers. Because these wounds can become serious if they don't heal, they demand prompt medical attention. Uncontrolled diabetes may result in extremely high levels of triglycerides, leading to eruptive xanthomatosis. This condition causes clusters of small, tender, and itchy bumps, yellowish on lighter skin or grayish with a yellow hue on darker skin, typically found on the buttocks, thighs, elbows, or knees. Once blood sugar levels stabilize, these bumps often resolve. Xanthelasma appears as yellowish or yellowish-orange bumps or patches near the eyelids. Often related to high levels of blood fat, this condition can signal poorly controlled diabetes. Although mostly a cosmetic issue, it's a clue to underlying metabolic imbalances. Diabetes weakens the immune system, making it easier for bacteria and fungi to take hold. This can result in recurring infections such as oral thrush or yeast infections. Frequent skin or mucosal infections should prompt a checkup to rule out or manage diabetes. Common, harmless skin tags can also serve as a hint. These small growths, often found on the eyelids, neck, armpits, or groin, are more common in people with diabetes. Although benign, their appearance, especially when multiple, might be an external sign of internal imbalances. Granuloma annulare presents as clusters of small bumps or raised patches that can come and go. While most people with this condition do not have diabetes, studies suggest that when it appears over large areas or fluctuates, testing for diabetes might be warranted. Starting as reddish-brown spots on the shins in lighter-skinned individuals or purplish spots in those with darker skin, necrobiosis lipoidica gradually forms patches with thinning waxy skin in the center. Although not painful, these discolored areas are a marker of microvascular changes associated with diabetes. Distinct from other blistering conditions, diabetic blisters appear suddenly on the hands or feet without an apparent cause. These painless, fluid-filled blisters often resolve on their own but are strongly linked to diabetes, particularly when other symptoms are present. People with diabetes often experience persistent dryness and itchiness of the skin. This dryness, known as xerosis, results from poor circulation and altered sweat gland function. When skin becomes chronically itchy, it's more prone to cracks and infections, signaling that better glucose control might be needed. Diabetic cheiroarthropathy is characterized by thickened, tight skin on the hands, making it difficult to flex the fingers. This stiffness and limited movement arise from glycosylation, the binding of sugar to collagen, and is a notable indicator of long-term diabetes effects. While general infections are common, specific fungal infections like athlete's foot, also known as tinea pedis or candidiasis in skin folds, are particularly prevalent in diabetics. The combination of high blood sugar and a compromised immune system creates an ideal environment for these stubborn, recurring fungal problems. Though not exclusive to diabetes, seborrheic dermatitis, a condition causing red, scaly, and sometimes greasy patches on the scalp, face, or chest, can be more severe in those with metabolic disturbances. In people with diabetes, the inflammation may be harder to control, indicating a broader systemic imbalance. Diabetes can manifest in many ways, and skin changes are a visible window into your overall health. Whether it's a small patch of discolored skin, unexpected blisters, or persistent dryness and infections, these signs should prompt you to consult with a healthcare professional. Early detection and proper management of diabetes can help prevent further complications and maintain your quality of life. Stay informed, monitor your skin, and remember, when it comes to diabetes, every detail matters.